So I am Tamie Young. I'm Assistant Administrator for Stillwater Medical. And my area of responsibility is the business processes across our organization, across the hospitals and the clinics. So anytime that I get an opportunity to help people better understand how Medicare works, I've been doing this for over 26 years. Back when I first became passionate about it, learning for my family and helping them to navigate the waters of Medicare. I will tell you the information that we have as a resource now has come a long way from what it was 26 years ago. And that book right there is evidence of that. So, am I ready? Jeffrey, am I ready to just click? Am I ready to go?
I have to share your screen, please.
So without further ado, we will get started. Let's talk about Medicare. Okay, so as you know, each year things change. So we are approaching what the foundation times my presentation each year with the open enrollment period. So starting October the 15th, you go into the open enrollment period for Medicare. That's if you're already established on Medicare and you want to make changes, you have from October the 15th through December the 7th to explore any opportunities that you want to check into. And I'll talk a little bit more about that as we go. So every year this goes up. I look at my stats, I look to see where we're at, and these numbers always blow me away. The only thing about what I have up here on the screen that I really bring the importance to is the fact that $995.7 billion will be spent by Medicare on healthcare for the beneficiaries. That's anticipated in 2022. The other thing I want to point out on this graphic is not the individual pieces in the graph, but it is just to set the stage for how I've changed. For those of you that have been with me down at the library when we've done these presentations over the years, or you've seen me in the past, you will remember a time probably 10 years ago that I did not spend a lot of time talking about Medicare Advantage plans. In fact, at that point in time, I would tell you for here, because we had very little to choose from, I almost steered you away. I may still, but just depends on your situation. But I talk more about it now because we need to know and we need to understand. What this graphic tells me is in the spending and what's anticipated for that $995 billion is we're at 41% of the spend is on beneficiaries with Medicare Advantage plans. So we're about to hit an even keel where it used to be a very small percentage of people. So
It's the window I'm trying to share.
Oh, okay.
That's
Okay, we'll get it going. A little technical difficulties will be there. While we're doing this, for those of you that are watching us on Facebook Live, if you would, I'd like to know who my audience is. So, and I'll take a poll here in the room as well. So how many of you on Facebook Live are already on Medicare? And if you would share if you're on a Medicare Advantage plan or traditional. If you're not and you're just learning for experience and getting ready to go on to Medicare, become 65, if you would share that as well. So for here in the room, how many of you, first of all, is everyone here on Medicare? Okay. And of those, how many are on a Medicare Advantage plan? Okay. And that's okay if you don't know. We'll figure it out. I can talk with you later. So that lets me know who I'm addressing. And for those of you that respond on Facebook Live, I will address you as well. Okay. Can I press my button? go back. Because I probably made that happen. Go to slide 3. Yeah, a whiteboard and eraser. Yeah. I could have some colored markers. That'd be cool. Yeah, I can take that. Almost there. All right. Okay, we're back. All right. So Medicare is the nation's largest health plan. So a lot of times when we talk about health plans, we think of insurance, other insurances that we purchase. But truly, in the United States, Medicare is the largest health plan. Right now, in anticipation of the enrollments and during this open enrollment period, it should take us up to about 65 million individuals across our nation that are covered by the Medicare program. So again, ever evolving, continuing to grow. It serves anyone who is 65 years of age. We call that the traditional plan. When you turn 65, you're eligible for Medicare coverage. Or if you are under the age of 65 and you have a disability which qualifies you also for Medicare coverage. There's several rules that go along with that, but that's what the program is designed for. And then lastly, but certainly the most important and complicated part of the Medicare program is that for individuals with end-stage renal disease, it has a definite, I call it a bucket of money, a fund for that. And it is very, very much needed. Okay, so this is when I go into my alphabet soup. I mean, if you've read the Medicare and You book, or if you've heard anybody talk, or you go to buy your plan, you know we talk about parts A, B, C, D. A is your traditional, it's your original hospital plan. A is what the Medicare program was designed around. It originally, back when, if you went to the hospital, you needed to be an inpatient. Back before modern, medicine and technology brought us to where we are today. So it was designed around an inpatient coverage. Then they came up with the Part B, which is your outpatient, your Part C, which is the Medicare Advantage plans, those commercial plans that are subsidized by the Medicare program, and your Part D, which is your drug plan. We'll talk a little bit more about those. And your Medigap, which is your supplements, and I'll go into those as well. So just the basics. Let's get A and B out of the way in our alphabet soup. So A, as I said, is your inpatient plan. It is the funds that cover when you are in the hospital, you have been admitted for a diagnosis that qualifies you for an inpatient stay. It also covers your skilled nursing stay. So say if you have a hip surgery and you need to go after you've had your surgery and a few days in the hospital, you need to go to a skilled nursing facility for them to do rehabilitation, get you back on your feet, or a rehab unit. It covers that. Home health, it covers home health services that are related to an inpatient stay. That's covered under Part A. And then your hospice care as well. So all of that is under that core Part A, if you look at your Medicare card. Part B. Part B is our outpatient. This is the most widely used benefit in the Medicare program. So this is your physician visits. This is any other providers that you go to, any other type of services, physical therapy. It also has your home health. So just regular home health services are covered under the Part B. Your preventive services, such as your screening colonoscopies, your wellness visits to your physician, those type of things are covered under your Part B plan. Durable medical equipment, your oxygen, things like that, all covered under the Part B plan. So the logical question that people always ask me is, okay, but what does it cost? How are we doing with our cost? Especially you newcomers that are looking to be on Medicare soon. So typically your Part A, if you've worked 40 quarters in your lifetime and between you and your employer, you paid into the program, then you pay nothing for Part A, nothing for Part A. It does have an inpatient deductible. So if you are in the hospital from 1 through day 60 in a benefit period, and a benefit period is 60 days, you owe a one-time inpatient deductible if there's not a break in a spell of illness. That is $1,484. That's the 2021 number. This program is happening a little earlier than Medicare publishes the 2022 rates. So that may change, we'll see. Your Part B, the typical monthly premium for someone coming on to Medicare right now, $148.50. That's the 2021 figure as well. The deductible, $203. That's annual. So you pay an annual outpatient deductible. You have to satisfy that $203 beginning in January, and the benefits do not kick in and pay until you pay the $203 out of your pocket. Co-insurance for Part B, it's just straightforward. It's 20% of what Medicare allows. So 20%, if Medicare says that you had an X-ray and it's worth $40, then you pay, your portion is going to be 20% of that. Okay, so this is a typical question for newcomers to the Medicare program. If I am still working at age 65, do I need to purchase Part B? My answer is maybe. It depends on your situation. Anyone who is still covered by an employer group health plan and you intend to work throughout the next year to receive the benefits, then no, I would not spend the additional $140 some dollars or $150 a month on a Part B if you have it through an employer group health plan. If you are purchasing your insurance through another means or a COBRA or on the exchange, then yes, you would need to purchase Part B to qualify. So the caveat with the Part B, and in recent years that they have begun to penalize late enrollment, is that you have to have proof of credible coverage. You have to be able to show that you were covered during a period by an employer group health plan, and then you can delay that and save that money for later when you need it. That is probably one of the most common questions that I get throughout the year that people call me with as they are getting ready to retire. Is do I or don't I? You're going to get your Part A and you want to go ahead and get that set up. But your Part B, if you are covered, you can delay. So I have Medicare, Part A and B. Am I good to go? No, we need one more thing, don't we? What is it? That Part D, alphabet soup. You know, we skip over C for this one, and I'm going to skip over C right now. We're going to go ahead and talk about the drug program a little bit. Give you some basics, and this may trigger some questions. And I will take questions at the end, because this usually gets you there. So Part D. In 2006, Medicare was looking to, or the government actually was looking to help or try to solve the our ever rising cost of medications in the United States. And they had been working on this for some time. So in 2006, they rolled out the plan that private insurers would begin to sell prescription drug plans, PDPs. You'll see it in writing a lot, PDPs, prescription drug plans. With those plans, the intent was that there would be a shared relationship between the insurance plan and the beneficiary to begin to close the gap on the cost of Medicare so that there was not so much coming out of your pocket. However, it didn't have any impact on the manufacturers of the drug. So as you see, the cost of our medications have continued to rise. The plan itself took longer to work than what they had planned. I'm going to talk about a donut hole here in a minute. We have began to narrow the gap over the years, but it's taking longer than anticipated. Once again, it started in 2006. So you've got plan A, you've got plan B, and plan D is not mandated. They don't say you have to have it. However, if you delay enrollment in it, your premiums will be penalized for a delay in enrollment. Some of you may have heard a story that I've shared in the past, and that is my father. I was a daddy's girl, and my dad, in 2006, I get a phone call from him. I was living over in Grove, Oklahoma. I was working at Baptist Regional Health Center in Miami. My dad and stepmother had a motor home. They traveled a lot, and I get this phone call, and my dad says, "What's this Plan D thing?" And here I am in the community. I'm teaching about it. I'm trying to explain to people how it works. And he says, "I don't take any medications. Is it going to pay for my aspirin?" You know, kept kind of chiding me. And I said, "Daddy, they say you got to have it." And he said, "I think not." I was very respectful of my father, and I went along with him. My stepmother went right in line. And that was fine for quite a few years until we hit, for him, he got away longer than Betty did. So 3 years later, she was diagnosed with breast cancer. And again, they had been on no medications. And luckily, we caught it early through a procedure, and then she was able to take oral chemo, which in 2009 was very expensive. And we got her on the Part D plan with a hefty penalty for a 3-year delay in sign-up. So 36 months of a penalty. She had to pay a one-time fee. They had a calculation for it. And then her premiums are still to this day higher because of that. My father lived to the age of 91. He died just a few years ago, had a wonderful life, and he never signed up for Part D. In the end, and he had Parkinson's, so that was his only medication. And in the end, the small bill that I ended up paying was something like $1,600. And so he made it work. I can't tell you yes or no. I'm just saying what happens if you don't have it. Maybe it's when I delay. Maybe I'm talking too much. So I'll let you do that. When a little bit more on the drug plan, and that's the cost. So there are several plans for you to choose from. Lots of insurance companies sell the plans. You can compare them on the Medicare.gov, so my Medicare website, and they will let you put in your medications. You can compare the plans. If you prefer working with individuals, there are local insurance companies that sell Medicare Supplements and the Medicare Part D plans, and you can see what works best for you. One common question that I do get asked about the Part D, and that is, once you purchase your plan and are you good to go, then year after year. I recommend that, especially if you have changing medications or have updated your medications, that you check each year during the open enrollment period that starts October 15th, and make sure if there's been any changes in the tiers and the formularies and how they process the cost for your medications. Very good. So for the Part D and how does it work? Let me just kind of review this part quickly. So you're going to choose a plan that is approved by Medicare. So the only people that sell the Part D plans are those that Medicare has approved to be a Part D plan or a PDP. Each of those drug plans, each of those insurance companies, they have their own list of medications that they cover and at what rate they cover them at. That's called a formulary, okay? They can't have one big formulary because every company can have their own, okay? Just the way that they have it set up. They may deem a name brand at a different tier. So within those are tiers. You have your generic. So we all know we like to go generic when we can if our doctor says that works well, because we know that that's less expensive. And then as we get into the name brand medications or new things on the market, they may be in a different tier. Within those, that may be a different percentage that you pay out of your pocket. Okay. So you want to verify when you're purchasing, like I said earlier, the medications that you're on, and make sure that your plan will cover that. You may need to make a change, and that's why we have the open enrollment period every year. Okay, premium ranges. I got on today, October 1st, the Medicare.gov website, the My Medicare. It was updated to include plans that are on the market, getting ready for open enrollment. Now, although it was updated today, I have in past years, the closer I get to the 15th, some of those plans change on there. So this is just from what I'm seeing today in the drug plans. Premiums range anywhere from $13.20 for the lower end, up all the way up to $138 for premiums. And that would be something that probably covers higher end drugs at a higher rate. Average deductible run at about $480, meaning you must satisfy the $480 before the plan will kick in and pick up a portion of the medications, your prescriptions, the gap. So this is where we were introduced back in 2006 to a term called the donut hole. The donut hole is when you and your insurance plan have paid combined out of pocket, that does include your deductible, $44.30, so $4,430. When that hits, that's a magic number. Now this may change in 2022, but that's just where we're at in 21. When you hit that magic number, you go into a period of time until you've paid $7,050 out of pocket, where you will share the cost. So from the cost of the drug, 25% of a name brand drug is typically what we as beneficiaries are going to pay during that donut hole period. Then the plan is going to pay a portion, and actually the manufacturer is going to pay a portion. When you and the insurance company have paid out of pocket in that gap up to $7,050, then it goes to the final tier, the final step, and that's where you only pay about 5% of cost. In that time, your generics probably aren't going to cost you anything or minimal as you process. That turns over every year in January. So it all starts over again. You work your way to the donut hole. So people who are on several medications, this can happen as early as May sometimes, just depending upon what you're on. Just be aware, and that's why you want to shop around. That's why you want to shop around. This is why we are consumers of healthcare now. I just have this screen, and I can help anybody navigate the web if they want to look at this. you can go in, it'll list each of the plans. When you go into My Medicare, you're going to look at just shop for your drug plans. You can shop for anything you want. You can shop for supplements that have a drug plan. You can shop for Part C that has a drug plan, or you can just look at the drug plans by themselves. The first thing it's going to ask you, one, is where you're located at, your zip code, so that it can kind of attach you to pharmacies in your area. And then it gives you the opportunity to put in the medications that you have prescribed so that you can shop. And so this is just an example of what it gives. You can also see the star rating of how each plan has been rated, what the cost is, and it's very straightforward. What is published is what it is. Okay, now circling back around in our alphabet soup to Part C. Part C, that's the Medicare Advantage plans. So this is where we have privatized or commercial, outsourced to commercial insurances a portion of the Medicare program. And this is where we have options. We can do the traditional, which is the ABCD or ABD that I just covered, or C, which includes all of your coverage. You don't use your red, white, and blue card anymore. You use an insurance card when you sign up for a Part C program. You must be enrolled in Part B. So you must still have your active Medicare benefits and pay that outpatient portion, that Part B premium that comes out of your Social Security check or that you may have set up on an auto withdrawal. The insurance then replaces your traditional Medicare plan. Every insurance company must cover you at a basic minimum rate of what Medicare would in the traditional plan. However, each insurance company can then decide, one, what it charges for things, and two, it may add to those services. They can provide more than what the basic Medicare plan does. They can also have requirements, such as you have to have something authorized before you get it done. If you need an MRI, you may have to get a special authorization for the reason that your doctor has ordered it. Or you may have to get approval for inpatient stays, those type of things. So there's rules just like in traditional insurance in a group health plan that you would have for these Medicare coverages. But the coverage cannot be less than what Medicare in the traditional setting has provided. You must stay within a network if you go with a Medicare Part C or an Advantage plan. Now, I find this interesting. I've been tracking this for a few years. I was at a conference in Washington, D.C. in 2018, and we had a speaker that had worked for the Medicare Part C plan. He worked for CMS in the Medicare Advantage division. And he then branched out and began his own company. What he had to share with us, I've been monitoring because I was kind of in disbelief at first, because again, we're still in rural America, still trying to get comfortable with the Medicare Advantage process. Really, we live a more laid back lifestyle here, and it's farther to the doctor. If we go to Oklahoma City or Tulsa, we are fortunate here in Stillwater because we've got Stillwater Medical and these wonderful doctors here that we could stay within our hometown. But Medicare, CMS, our government had planned that by the year 2025, they would transition 50% of all Medicare beneficiaries to a Medicare Advantage plan. And they probably had a path, a way that they would incrementally help that move. So whatever that plan was, is working. So if we look back, when I first started talking on this, in 2018, there were 21 million covered lives on a Medicare Advantage program. Each year, we have incrementally gone up. They're anticipating that in 2022, with this open enrollment period, we will hit 29 million covered lives. Right now, that would be 41% of all Medicare beneficiaries. And then with the goal being 34 million enrolled in the year 2025. So anyway, the boomers, that's us. I'm in that. We're helping to make that happen. Okay, so just in a nutshell, this graphic just displays the difference between the traditional and the Part C. So if you look all the way to the right, Part C bundles Part A, Part B, and it can bundle Part C, or Part D, the drug plan. Part A, Part B, Part D. Not all Medicare Advantage plans include Part D. Some of them will tell you when you go to shop that a drug plan can be purchased separately. If you look at this also, the original Medicare stays as it is. Okay, that's your first 3 circles. So what about us being consumers and shopping for a Medicare Advantage plan? It's not that hard. It has definitely gotten easier over the years. I think my biggest piece of advice is to ask lots of questions about it. Just as you were shopping for car insurance or anything else, you want to know about the coverage. You want to know about the rules. Okay. So I checked online this morning. This is hot off the press. I saw 6 Medicare Advantage plan options that included the drug plan within. Okay. So it included your A, your B, your D. I found 4 plans, and this is Payne County. So I put in the zip code for Payne County. I found 4 plans that are on the market that they cover your A and your B, and they tell you that you'll need to purchase a Part D separately. Most of the plans have $0 premiums for the base premium. For those that have the drug plans added, you'll have a premium on all but 1 or 2 that included the additional for the drug coverage. Okay, so it's in there. So even though we say your drug plan is included in your Medicare Advantage, there's going to be some fee that goes along with that, typically, depending upon what you need. That premium goes up and down depending upon what medications you put in that you're going to want the plan to cover. Premium $0 to $77 a month is what I'm seeing. Drug plan premiums from $0 to $700 a month. In-network versus out-network. There's your big thing. That's when you're deciding, do I want a traditional Medicare? And when I say traditional, the original plan lets you roam. Okay? The original plan lets you travel, lets you roam. And if you need health care along the way, or if you're a snowbird, you live somewhere else a part of the year, the traditional plan lets you do that without searching for the network. Medicare Advantage plans typically have a network for you to stay within. So you'll want to make sure that your providers, if you're looking at a Medicare Advantage plan, going to that from traditional, you want to make sure your providers are within the network of the plan that you're purchasing. There are out-of-network benefits in some of these plans. And that just means if you go out of the network that was established for the plan, you will have a higher out-of-pocket amount that you pay. You also want to make sure that they cover you out of network. Some plans will say we don't pay out of network. Other plans will say we will cover you up to 50% out of network, and you'll get 50% out of your pocket. Okay, so my next question. Sorry, I can do it. I know what I wrote. Oh, thank you. What if my former employer changed my retiree supplement to a Medicare Advantage plan? What if my former employer? So in the last year, this really caught me off guard last January, I have to tell you. After I presented to you all first part of November last year, I thought we were good. And at the end of December, the last week of December, and then on through the month of January, I began getting phone calls And there are several large employers in the state, mostly energy companies, oil companies, that converted their supplement assistance from your retiree benefits to a Medicare Advantage plan. In other words, they used to have a pool of money. They helped you buy your supplement for Medicare when you retired, and they've done it for years and years. And then they probably were looking at their spend, and an insurance company or several insurance companies have offered to create a Medicare Advantage plan for them as a group, employer group plan. And those are out there now. We have several oil companies, we have an energy company in Tulsa that have replaced those. So what does this mean? It means that if that happens to any of you, you need to just ask questions. You didn't get to choose the plan. They created an employer plan, which is not a bad thing. It's just that we have to be aware when these things happen. Then you have to say, are my providers in that network? Will there be a difference in my out-of-pocket, or do I need to choose other providers? So this is just an awareness. Again, it's not a bad thing. What you do is you have an option. You need to make an informed decision. So do you opt out? Each of these companies gave their retirees an option to opt out. The incentive to stay in was that there was a zero premium. So that sounds pretty good to me, doesn't it to you? So, but if you stop and only look at the fact that you went from paying $179 a month for a supplement to paying zero, if I didn't look beyond that, I could find myself in the middle of something and showing up for a doctor's appointment or for some outpatient therapy services, things like that, and not realize that I was no longer in network and it was going to cost me more than if I would have stayed on that other premium. So be sure you ask questions. This is definitely something that is becoming very common in our state. Okay, so I'm going to pause for just a minute, and I've covered A, B, C, now D. And I know by now, some of you are really cool with this. You're like, I got it. I'm just doing the same thing. I'm in traditional Medicare. I've been rolling with this for years. I've got a supplement. I don't get bills. I'm happy. Right? And others are saying, that's zero premium. I want to learn more about that because I may need to do one of them Medicare Advantage plans. And so that's where we want to make sure that we're doing our due diligence. I'm going to talk just a minute about the supplements though. Medicare supplements, that's your plan A, that's the other alphabet. That alphabet goes through N. There's all these plans on the market and their whole purpose in life is just to supplement traditional Medicare. For what Medicare does not cover, they pick up and will cover for you, depending upon the level of the plan that you purchase. Now, a few years ago, we went through a major change with this. And that is for lots of you, and lots of you in this room, you may have the Plan F. Plan F, I always thought was the Cadillac of supplements, and anybody who could afford to purchase it, I really wanted you to have it because that meant as you went through your senior years, you didn't have to worry about receiving bills. Because as long as they were covered services by Medicare, catch myself up here, they were good, they were covered, and you didn't receive a bill. And that when I work with people on do they want to change, do they not, we look at what types of services that you receive and how many bills you get from a hospital or your doctor. That is the one thing, that peace of mind that people like. Not to say that you wouldn't have the same thing with a Medicare Part C plan, a Medicare Advantage plan, it is possible, but it all depends on everybody's situation is different and all your healthcare needs are different. So the supplement though was designed for one thing and it works very well for that. You purchase it to cover at whatever level for what Medicare does not pay. You may have a secondary that is different than a Medigap or a supplement. A secondary, some of you that were in the teaching profession, maybe you still have your teacher's insurance, the state insurance as your secondary. That is good as well, but you have to remember those are regular insurances. They are not designed just to pick up what Medicare doesn't cover. So sometimes there are things that you still have to pay out of pocket with those. So the important thing is to find a Medigap policy that works for you. The Medicare, the mymedicare.gov site, and again, it allows you to put in your zip code. You can choose, just like I told you earlier about the Part B plan, you can choose just Medigap plans, and it'll narrow down to what's available for you to purchase. Very, very simple. So they are, like I said, the alphabet soup, A through N. When they did away with the Plan F, for anyone who became 65 years of age after January of 2020, they left us with plans who you still have to pay your outpatient deductible. So if you retired, went on Medicare starting January 2020 and later, you will always have to pay your outpatient deductible. So these are the plans. See, I lost one of my yellow arrows. So the Plan C and the Plan F, those are grandfathered in. Anyone who already had them and wants to continue them, those are the plans that cover your outpatient deductibles and most all of your services that Medicare approves and after Medicare pays. The other plans all cover at varying levels. The Plan G is probably the next one in line that covers most everything except for your outpatient deductible. New plans have been introduced as supplements that for a lower premium you have a larger share of paying out of pocket. And you just have to weigh those out. Put a pencil to a pad. How much am I going to use it? How much do I anticipate based upon current healthcare services that I've been having? And what are the premiums? And what do I think my out-of-pocket is going to be? Scratching your head yet? All right, a little bit on COVID. Jeffrey gave you the update from Stillwater Medical. Just wanted to let you know that Medicare, regardless of whether you're on the traditional Medicare or your Medicare Advantage plans, that the core COVID services are covered. Your vaccinations, the testing, and the antibody treatments. Those are covered under the Medicare program. One thing that was surprising, for those of you that get that Medicare and You book that comes out, it actually just arrived in the mail within the last week at our house. You want to make sure that when it comes to probably the testing and the vaccines, there is a page in there on COVID. It's in blue, and it suggests that if you're on a Medicare Advantage plan, that you may, depending upon the plan you have, you may want to pull out that Medicare red, white, and blue card that I tell you to put away in a safe place when you go on a Medicare Advantage plan because you don't need it anymore. It says that you should probably pull it out and take it to your visit with you. And that's because the vaccines are provided, through the government, through the health departments, through sources where those are covered. We don't pay for those, but the administration of which is what you have to pay for. So if you have a Part C plan that does not cover it, Medicare says that they will, and you just might want to have that red, white, and blue cards back up. That was a surprise to me. That was something new I learned last time. All right, a little bit more on some noteworthy information. And that is assistance that is available for premiums, just depending upon your income level. So these, then they are called extra help programs, have come a long ways, and they have expanded the income level. So for anyone that may need assistance, or you know that may need assistance with a Part B premium, maybe they are not able to pay the Part B premium, or a drug plan. We have the availability to apply through the Social Security Administration for assistance. The income level breaks are for a single person making less than $19,320, and other resources. Other resources means a bank account, savings, life insurance, those kind of things. It does not mean your house. It does not mean your car. It does not mean anything like that of less than $14,700. Again, Medicare and Youth, this is your best resource. You can get it on an online version. Some of you that have set up a Social Security account online where you can go in and monitor things, or you've set up your mymedicare.gov, it gives you an option if you just want the electronic version, or if you want the paper version. You can download this anytime and have it. It is very easy to set up your My Medicare account, to set up your login. Once you do this, it allows you to also track your bills. So anything that has been billed to Medicare, you can see on here. You can track it, you can track your spend, you can do your research on what's covered and what's not. Okay, before I open it up to questions, just a few final thoughts. I know I cover a lot of information in a short period of time in these sessions. My main message to you is, where the state of healthcare has brought us, and I've used the term earlier today, it's brought us to be consumers. You know, we're not just consumers of healthcare services, we are consumers. It's brought money and value into the equation, of which, 30 years ago, 40 years ago, who would ever thought? Be a consumer, ask questions. When you are even on the healthcare side of things, when you are at your doctor's appointments, when you are faced with testing, own it. Ask questions. Don't think, oh, they're going to think that's silly. The more you learn, the more you know, the more you ask. And that's what healthcare providers are there for. They're there not only to take excellent care of you, but they're there to answer your questions. And the more you know, the more informed decisions you can make about your health and your care and your wellness. So with that, what questions do you have for me? Yes.
The disadvantage of the advantage doctors in Stillwater.
Okay, so the question is, in the past, the big disadvantage of the Medicare Advantage plans is that in Stillwater, in this area, that we didn't have physicians that were on the Advantage plans. So in Payne County, Humana is our Medicare Advantage plan that they market here. And yes, Stillwater Medical and their physicians are signed with Humana. So there have been other plans, and there is one other plan that is actually a health savings account that is marketing on the website in Payne County now. It was there this morning. There's 2 or 3 options for that. I am not familiar with how it works. It's a high deductible plan. So, and to my knowledge, we haven't been approached about anything like that. Humana is it. There's several Humana plans. We are signed with Humana. Yes, we are. Yes.
We often see this ad on TV with Joe Namath. Is that trying to get people to go to Advantage, or what is that?
The Joe Namath one.
Yeah,
Advertisement with Joe Namath.
he said, call this number and you can get a lot of free medical service.
Oh, okay. He probably is. So there are a lot of celebrities that are spokespersons for different health plans. I'm not familiar with the Joe Namath one, and maybe he's changed so much I just haven't recognized him on the app. So he is a lot uglier. I used to really like him. You know, the thing about those commercials, you know, there's the one that was around for years of the couple sitting on the couch, and I think it's the man said, I wish there was a health plan just like it was when I was working. You know, and all of those health plans exist. And yes, if that is what he's calling to say, and they do call it free, but remember, free is a relative term. Okay? Because if you don't pay a premium, we're all very logical people in this room. If you don't pay a premium, you're going to pay something else. So you may have, and I had a slide earlier that I didn't stay on, but it broke down. If you go, so some plans, if you go to the emergency room, each emergency room visit may be $90. Or if you have an MRI, maybe every MRI is going to cost you $360. Or if you have an outpatient procedure, say you have a knee arthroscopy, there's a copay that may be $390. Okay, there's going to be costs associated in a Medicare Advantage plan. You just need to learn the plan, ask the questions, and have someone help you to navigate it.
I have a question online.
Okay.
If you signed up for Part A at age 65, but had private insurance plan through work, but are now turning 70, still working with insurance, is it correct that you have to sign up for Part B, D, or C now?
So the question is, if you, at age 65, you were still working, you have your Medicare Part A, and you deferred signing up for Part B because you had your group health plan through work. And now, approaching the age of 70, is it true that even though I'm still working drawing insurance, that I now have to purchase Part B and Part D? That may be an employer decision. So some employers will only carry so long, or some of them convert your group health plan into that of a secondary and say, when you reach a certain age, we expect you to draw the Medicare benefits, and that we will pay the secondary, we will provide the secondary benefits for that. I am not aware of a Medicare rule that says that, because remember, the Medicare Trust Fund, as long as there is someone else whose coverage is primary to Medicare, Medicare thinks that's a good thing because they're saying that saves the trust fund. So I am not aware of anything on the Medicare rule side that says at the age 70, you have to make a decision. That would be an employer benefit change. Are there any more online, Jeffrey? Okay. Did someone else here have a, yes, question?
TV, the ads say they will add money to their social security check for those advantage plans.
They say they will add money to your social security check on TV.
Dynamite is one of them.
Dynamite. And you choose. Okay. So again, let's go back to logical thinking. Okay. I don't think anybody can add to your social security check. Now, what they can do is they can allow your check to remain. So you're going to still have to pay your Part B. So that $140 some or $150 that comes out of your social security check every month, you're going to have to continue that because you have to pay into the Medicare program. So if what they're saying is just a play on words, that they're saving you the additional expense of a Part D plan, you know, or your, maybe some co-insurance is different. Maybe that's what they're saying, but I'm not aware of anyone. I will. You guys have brought two, I've got to watch more TV. You guys have brought two things to my attention today that I'm not aware of. So we got Dynamite, and I got to look for Joe Namath. Okay. All right. Any other questions? Yes.
When I get my bill, when I go to the doctors or something like that, the doctor charges $289. But by the end of what Paul takes reduced, he gets 89. Who pays the difference?
So that's a good question. So the question is, when I go to the doctor, the charge may be $200 and some dollars. But when I see the explanation of benefits from my insurance plan, it shows that the doctor only got $89. Who pays the difference? So including Medicare, every insurance plan has a set value for what they pay for a given service. So say at your doctor's visit, his level of decision-making, and because that's what we're paying for our doctors, you know, they're very wise people. So it's their level of decision-making and their managing of our health situation and diagnosing. And each one of those has a level. Maybe you have a visit and it's doesn't have a lot going on, it's a level 2, maybe a level 3 or level 4. For every one of those, there's a code, and Medicare has a dollar amount, or your insurance, your Medicare Advantage plan has a dollar amount associated. If you go for an X-ray, for every X-ray that can be done, there's a dollar amount associated. By the agreement, for the provider or the doctor accepting that insurance, they agree to take that money plus whatever the insurance plan says will be the patient's portion to pay. And every plan has their own, and they're not alike. So nobody pays that. It has to be adjusted down to the portion that the insurance plan says the patient will pay if there's anything due from the patient. And that's what you have to accept. That's a good question. Okay, y'all, I appreciate you so much. And I have some cards up here. I am always willing, this is a passion of mine, to help you understand. If you need to contact me, I'm happy to make appointments to go through things with you to help you navigate